Okay, welcome everybody. Baruch Hashem, we're here at Living Cities. We are doing our life skill series.
Can't see you.
And can you see me?
No.
We are doing our life skill series. And just to give a short introduction about life skills and the reason why we do this, we really make a point to educate women earlier on. That way they don't say, I wish somebody would have told me. For anyone who's ever had a baby, or anyone who's ever gotten engaged, or anyone who's ever been through a life experience that they always say, I wish somebody would have told me. So our goal in life skills is to give you the I wish, whatever somebody you wish would have told you. And we have the incredible source to have Sara Chana. She is a homeopath, a classical herbalist, a breastfeeding expert, and also a birthing instructor. And all the incredible titles. There you go.
No, it's straighter. Okay.
All the incredible titles that she has earned. She has worked so hard. I've known her now for about 8, close to 9 years.
I don't know how old's your oldest.
Exactly. That's why I was like, about to be 9 years. And I always hear her saying, I'm going through this course and I'm going through this, I'm learning this thing, and she's constantly growing. And that for me is the epitome of an incredible woman. So kol to her, and thank you so much for joining us.
Of course. Thank you. Let's see if this is working. And how do we get this little screen so that, is everybody also seeing this screen on top, or we don't need it? Yes. Join.
I thought it did.
It did go away and then it came right back.
Oops. Okay.
And somehow the lighting's too, it's like weird. It's too, I don't know if anybody can, I don't know if the lighting is.
Here, can I move it?
Yeah, I would move it more this way.
Yes.
Okay, excellent. Okay. Let me just make sure this is working. Well, I could see that because then I can show things and see how I'm showing. More that line across the top. Should we have that? Is that on someone's phone? No. If someone's no, okay.
No,
over here, it's even better. Oh, it's only for us?
Yes.
Okay, as long or put it over there. Yeah. Maybe to the side. No. Okay, so maybe on this side.
Yeah, I'm going to.
I don't want to get in their way. Okay. Okay, move it a smidge. Hold on 1 second. Sorry, guys. I just no internet in my house at all, so I could not email her the slides. All right. Okay, and then if we move it over to the side, we won't have it, the shadow. I just don't want the shadow for them. Okay. The problem is, Michal, look, that light's very, very bright over here. I think it just distracts, unless we don't want, okay. It's also not great. Hold on. Take that one off. And then, hold on. You turn that one off. Then can you try one more time the lights in the back over there? I'm so sorry, ladies. That's actually better for this, yeah.
Yay.
Oh, for your viewers. But okay, is that bothering you? Can you guys still see that? Okay, yes or no? Okay, excellent. Okay, great. Let me just make sure we can move our slides. Okay, we can't. The arrows are not working. It didn't last time. Okay, I had to do this last time. It didn't last time. I actually had to use this. Let me see. The arrows aren't working. Oh, how'd you do it? Now they are?
Yeah,
okay.
You have to click into that.
Just, okay. Can I just do this? Okay, good. Okay, amazing. Okay, hi, ladies. Sorry for the delay, and welcome out there for everybody that's joining us. Let me move this a little bit like that. That'll be a little bit easier. Okay. All right. So anybody that's listening on Zoom, we're going to ask you to write your questions in the chat box, right? And that way at the end, we're going to try to save time to be able to really get to those questions. And then we're going to live, ask questions for our live folks, and just raise your hand. And then I have to remember to repeat your question because then they can't hear it. We're just getting better every time I do this. Okay, so I'm Sara Chana Silverstein. Welcome, welcome. You can join me and follow me on Instagram. I put up little videos 3 times a week, and you can learn more about what I do with my book, Moodtopia, which is available on Amazon. That's my little PR for the moment. And now let's get into our topic. Okay, thank you. And thank you, Living Chassidus, for sponsoring this amazing event. So let's talk about our newborn. Newborns are really scary and weird for most people. They look like little aliens. And even if we like babysit, like nobody comes over and says, can you babysit my baby that's 24 hours old? You know, you babysit like a 6-week-old or an 8-week-old. So those babies, when they're first born, are very strange, very weird. And the most important thing to know is that babies have been swimming around in amniotic fluid for 9 months. They are water creatures. They don't breathe inside the womb. They actually are fed through their belly button, their placenta. They're fed blood, and the blood is oxygenated so that they get their oxygen. And the most peculiar thing in the world is that babies swallow their amniotic fluid, pish it out, and swallow it again. So it's a very weird setup in there, okay? But when they come in the world, it's their first time that they're exposed to oxygen and air. So the first thing about babies is that they tend to be covered in this white, goopy, fluffy substance. It's called Vernex. And in my world, we don't want to wash off that Vernex. We didn't do this last time, did we? Did we go through the Vernex? Okay, good. We don't want to wash off that Vernex for the first week of life. What the most amazing thing is when you deliver a baby, it's bloody and yucky and a little strange and bizarre and full with all kinds of things. And then you just take a towel and wipe it. The Vernex stays because it's sticky, but they don't need a bath the first week. And I'm very into cleanliness. I'm a little OCD, washing my hands, making sure everything's clean, but not when it comes to newborns. So the Vernex is made with proteins. It's got lipids that act as a barrier. It's got antimicrobial agents. It helps the skin hydrate and transition from a water skin to an air skin, very low in pH. It protects against pathogens. And what happens is it will slowly but surely kind of sink back into the skin and it will disappear, okay? When you give birth in a hospital, they're right away scrubbing the baby. So there is a homeopathic remedy from Vernex, by the way, we discussed this before. So Vernex is said, who's a person that needs the homeopathic remedy of Vernex? A person who has trouble having their own being and not be influenced by people around them. Meaning, not in a bad way, I don't want to say influence, more like affected by people around them. People that watch the news and are sure the same is going to happen to them. If they hear there's a neighbor down the street that's sick, they have not made this barrier where they can listen to information, metabolize it, and figure out, can they help? Can they not help? Should they intervene? Should they not intervene? So they tend to live in a state of panic because they don't know what they're supposed to be taking in on the world around them. So the Vernex is a barrier where the child can safely observe their environment, see what's going on in their environment, be exposed to viruses and bacteria, and protect themselves as they integrate themselves from a water world into the world of air, pollution, pesticides, everything else that's around us. So for me, Vernex is something to leave on that baby. So the next question is, and here I don't love that the baby doesn't have Vernex on it, but what can I tell you? Hard to find those pictures. So why do we want skin to skin? So there's this whole misunderstanding about skin to skin. First of all, Jewish ladies tend to not feel so comfortable laying around naked. They say in Mitzrayim, how did you distinguish the Jewish women? They naturally were tznius, and they kept their Jewish names. So by nature, we tend to be a little bit more covered. So the skin to skin is really just a physiological need the baby needs in the first couple hours of life. What happens is, theoretically, inside the womb, it's the only sterile environment in the world, but we've now seen 10 pesticides in the amniotic fluid. So babies used to be born completely in a sterile environment, and what they needed to do was be attached to the mother to start to get bacteria to start growing on their skin to build their immune system. So the reason, I think we touched on this last time, right? The reason that we do skin to skin is so the baby begins to colonize in bacteria and able to fend off any invaders in the world around them. I think we discussed this last time also. If you don't feel like you want to do skin to skin after you give birth, you may not want to attach that baby right away. Your husband, with his bad breath, wearing an undershirt, sits his shirt, and maybe a jacket on top of that, sweaty and disgusting, is amazing because the baby's already been exposed to his bacteria. So all he has to do is breathe with his bad breath right onto that baby, and the baby's going to start to build their immunity and get used to his bacteria also, which is very important. But also, if the mother can have the baby skin to skin, as I said last time, the stomach heats up 10 degrees hotter so that the baby, it's a natural baby warmer. They don't need to separate the baby and put the baby in a warmer. We're warm. Our husbands are also warm and sweaty, no problem. It can reduce the risk of hemorrhage in the mother because it raises her oxytocin levels. And the most important thing, a famous herbalist named Stephen Booner said, it's all about colonizing the baby with bacteria for a healthy life. That's why we're skin to skin, okay?
How many minutes?
A question was how many minutes? 2 minutes, 5 minutes, 10 minutes, whatever you feel like doing. Okay. It's better to put them on the stomach or anywhere on your body. If for some reason you are bleeding postpartum and they have to separate the baby, you want the husband to follow that baby. And even if they put the baby inside a warmer, you want your husband to go hold the baby's hand, touch the baby. I mean, he can wash his hands if he was just like in the parking lot or the bathroom, don't get me wrong, but definitely put his hands on the baby because the baby will feel his warmth and feel his energy. It's a lot more comforting for a baby if something's going wrong with the mother or the baby, because he's heard the voice of the father for months. You know what I'm saying? Just to say, I'm here, I'm here. So that kind of comfort I really like. So it all depends on what the scene is. So let's talk about newborn skin. Most newborn skin starts to peel the first week of life. They get dry skin in the palms of their hands, especially around their ankles. They can lose skin on their face or their arms because their skin is changing from a water environment to an air environment. So it's very normal to have cracking of the skin. Basically, I say leave it alone. Just leave it alone. It's perfectly 100% fine for the baby to start peeling. If you feel it's too dry, sometimes we put a little bit of olive oil or calendula oil or plantain oil, but it's very normal and it's kind of natural to watch the baby go from Vernex, if we don't touch it, into the peeling of the skin. It's actually a very fun scientific experiment because you'll learn a lot more about a baby's skin. Now, rashes are very normal. Baby skins are really acclimating from the water environment to the air environment. Basically, I say leave the skin alone. Leave it alone. Most baby skin will absolutely acclimate to the environment that they're in. Remember, one person could be born in Alaska, 20 degrees below zero. Someone else could be born in Palm Springs where it's 110 degrees. There are different environments. There's different humidity. There's different in the air quality. And this baby is trying to acclimate and read what's going on around the baby. Make sense? So if you look at these pictures, the one to the left, the upper left, that's a normal skin. The one on the bottom is still a normal skin reaction. The one in the upper right-hand corner is an eczema. And I would speak to the doctor about that when it gets crusty, yellow, very, very dry and can bleed. And the one below that is a bacterial infection. So basically the skin's going to go through all these evolutionary processes. Question was asked, how do you know the difference? So look at the one on the far left up and the far left down. That's normal. You can't see it as well on this wall, but you can on our Zoom link. When it gets crusty and starts bleeding, go to the doctor. But what happens, it's very interesting with babies, even if they're born with a full head of hair, most babies around 6 weeks lose their hair, get pimples, so they look like an old man with acne. It's like really, and people will come in because I'm like, isn't this the cutest baby you've ever seen? And I'm always like, no, he looks horrible. But I go, oh yeah, it's such a beautiful baby. So babies go through very unbeautiful stages. Mothers and fathers don't notice it, but the rest of us, for sure, we do. So skin like this is totally normal, especially around 6 weeks. They can get a big outbreak of skin. I just had a client earlier today, would never mention the name, and the lower abdomen was the worst rash you've seen. The food she's eating is making the urine too acidic, and it's actually burning the skin. So we can get that, but that's a little more complicated. But weird rashes, normal. Red blotches, weird rashes, normal. So cradle cap is also a normal manifestation. This is another mother that's going to say, is this the most stunning baby you've ever seen in your life? And the answer is no, but we all say yes, right? Somehow Hashem makes it that women fall madly in love with their babies, no matter what they look like, whether they're screaming at 2 o'clock in the morning. But for us as outsiders looking in, cradle cap is usually due to an allergy in the baby. A little bit of it is normal. Oil tends not to work for this very much. I did put on this slide plantain oil and calendula oil if it gets irritated. But if it gets really bad, like these pictures, what you need to do is take actually Head and Shoulders. Head and Shoulders, the Dutch adult shampoo, because this is made by the sebaceous glands. And what you do is you put your baby's head under the sink, not his face or eyes. Wash the hair a little bit, put a little Head and Shoulders, hold the baby upright for about 5-10 minutes, and then rinse it out again. I don't like them to do it in the bath because then they splash and they can get it in their eyes. But Head and Shoulders, and I'm the organic, natural alternative one, but it doesn't work. The oils don't work as well. So this is a normal stage. Sometimes it can go down to the eye, to the eyebrows. We need to correct something in the mother's diet if it gets really bad and out of hand. Well, cradle cap usually comes in about 2 to 6 weeks. The question, thank you. The question was, when does it come in and how long does it last? It usually comes in between 2 to 6 weeks. It'll usually self-resolve by about 9-10 weeks. If it's not, it needs a helping hand. And I have babies that are 2 years old and still have terrible cradle cap. By 4 months, cradle cap gets incredibly itchy for children. And when they start to be able to use their arms, they start scratching it. And that's when we get bleeding heads. And then we're open for fungal infections and bacterial infections. So it's something that not all babies get. It's not as common as people want to say. I like to be very proactive because I don't want an antibiotic at 3 months because they scratched their head and they got it infected. Okay. So newborn baby's eyes. So if you look at the bottom picture, you'll see that that baby has a bloodshot eye. Very interesting. 99% of the time, the mother will also have a bloodshot eye. These bloodshot eyes means that the mother was pushing in the wrong position. When you push your baby out in the correct position, we don't get these bloodshot eyes. They're not dangerous. They will self-resolve. Total normal. But usually a woman was pushing so hard that she also broke some blood vessels in her eyes. So when I see it in a baby, it's rare if I don't see it in the mother also. The upper picture is what is called a clogged tear duct. Not dangerous, very common. It's not an infection. It will resolve itself. I have down here, there's a homeopathic remedy called silica, which I do like to give for these babies if the parents are into homeopathy. What happens is there's a little tiny, it's a little teeny pathway or hole in the eye that is there that cleanses our eyes all the time. And with kids, it gets clogged and it will self-resolve and open about 9 out of 10 times. If it doesn't, there is a procedure where they dilate the eye, the little canal. I can't remember exactly what it's called, but that's very, very rare. What we do with these yellow goopy eyes is, again, this is the mother that says, oh, is my baby the most gorgeous? And this is a 6-week-old with goopy eyes, acne, losing its hair. Not the most gorgeous, but it goes away. So we either take a cotton ball with some warm water, or you can take a cotton ball with some breast milk and just keep it as clean as possible. This is not an infection, but when the goop is there, if you have a toddler that sneezes, the virus can just kind of stick like glue paper, just can stick. So I like to move it away every day. So babies are supposed to be floppy after birth. I was going to get a really cute picture of a floppy baby, but my internet was down today. So when they're born, they're floppy. They have no control of their bodies. Their heads go like this, their arms, because if you gave birth to a baby that was firm, your vaginal canal would be ripped to shreds. So it's very nice and normal that babies are soft and smushy so that we stay intact. There's 5 bones of the head that I wanted to get a picture of, no internet. There are 5 bones that need to cross over each other to come out of the birth canal. And then when the baby is born, the bones come right back out and reshape the head. So that's why this part of the head we don't touch in the beginning. This is where the soft spot is, but this back part of the head is strong, and this is what pushes through the birth canal. Basically, this is what babies do. We've discussed it before during labor. Hi, this is labor. Hi, this is pushing. So the head is a lot stronger than we think, but the front part of the head that curves over is not. I hate it more than anything in the world when they burp babies like this. Have you seen them in the hospitals? They bend them like this and they pull their poor jaws out. This is a way to get a baby to have TMJ. I don't believe in burping babies like this in their first couple weeks of life because it's not a natural position. The reason nurses do it, like at the Kimpeter home for Jewish women, there are 10 babies per nurse. So that nurse has 2 minutes to get that burp out. Burp, baby, burp, burp, right? We don't have to do that in our house. So when you burp babies, I like them to be way up on your shoulder, as high as possible. I like the baby's head resting gently on the shoulder. I want them to be able to pick up their heads and say, hi, oh, wow, who's in my family, right? So that's very important to me. I'll tell you one other thing that I don't have a picture of here, but this part of the back, when it's developed, they breastfeed better. They breastfeed better. They need this part of their back connected to their mouth. So when we breastfeed, which we're going to get into, I really want you to support this part of the baby's back. Okay. So when I'm burping them, this is what I like them to do. Now, what I hate in the world is when they say tummy time. Okay, yeah, just drop your baby on his tummy. He's breathing the ground. This is not exciting. There's no baby in the world that goes, oh, wow, I can't wait for that tummy time. All they're trying to do is get them to lift their head so they build their back muscles. Now, what's very interesting is as we age, I mean, you guys are all really young and so am I, but watch. When people get older, they tend to be like this. And this is their position as they age. And then it's hard for them to eat because their heart is smushed, their stomach is smushed, everything's smushed in. And then you have to give adults baby food because they can't digest anything. So we, as we age, are supposed to stand up straight. When we eat, our heart should be open, our lungs should be open, our upper body should be open so we can digest well. So they're trying with PT and OT to get the baby to lift their head. But watch me. If I have my baby way up here and a Tati comes in, the baby will go, whoa, who is that? Right? Or, oh my gosh, that's my little sister. So they're constantly in this position, able to build those back muscles. And or
any of my babies, they spend all day like that.
right, and they're always looking up. Yeah, and some babies do it by 2 weeks and some not till 9 weeks. You can also hold them in this position so they can see the world. Remember, they're floppy, but I want them to engage in the world. More important than how much weight they gain or how many times a day they eat, which we're going to talk about, they're engaging with the world is one of the most important things. That's how they learn compassion, sensitivity, just by engaging in the world. Okay, so babies are completely, hold on, going? Okay. Okay, all right, sorry. Okay, technical. Anyways, support the back of the baby's head and don't be afraid of the head. This is the soft spot. Obviously, we're not touching the soft spot, but this is the back of the head and this is the strong part of the baby. So we're going to be holding the baby in this position when we breastfeed. Okay, great.
When they sleep, does it like make their head flat?
Well, there's a whole discussion of how we should put our babies to sleep. Your mother, your grandmother, and your great-grandmother all put their babies to sleep on their stomach. There are rules to stomach sleeping. I can't legally tell you to do it. You can call your own grandmother. The question was position of babies' heads. But, you know, we have rules of sleeping in a bed. We don't want a memory foam. We don't want a feather bed. We don't want a water bed. We don't want lots of stuffed animals around. But I wouldn't just put them on their back all the time. Sometimes on their back, sometimes on their side, sometimes on their other side. I would vary that sleep. And if your grandmother put the baby to sleep on the stomach and she gives you the okay, then you can do that, not me. But again, we're working on lifting up that back. That's how they get strong. So, you know, we go to the gym and we all work out our abs, you know, we're doing our sit-ups. And every time I go with my trainer, she's like, well, let's lay on our stomach and work on the back. It's the hardest thing. It's the hardest, but that's really what gets you strong. It's as important to have those back muscles as it is the stomach muscles. Yes, yes, yes. In my experience, yes. Well, now she's big. Now she doesn't have a problem. I mean, she may want to reach for toys for sure. I'm talking about they're like 6-week-olds on their stomach. I'm like child abuse. Do you know what I'm saying? Like, but a baby this size, we're looking at a baby that's bigger. I don't mind a bigger baby on their stomach for sure. If you love your babies during nursing, support them well. Support their back, support their head, and we're going to talk about that. I just wanted to show you that this is a baby a little bit bigger than a newborn, but the baby really needs to be supported. Okay, so I had to, did I ever show this picture before? No? Okay, good. I want to make sure I don't repeat myself. So, you know, medicine goes through very weird phases, like very like strange. And so this was the concept that you should be on the 10th floor of an apartment building. The baby needed airtime, and you just stick this little thing out the window and the baby's flying in midair. I don't know how many babies crashed, but I had 5 boys in a row and my babies would have just, I don't know, crawled up and out. So that's kind of terrifying. Then we have the bottom one where they were very into like putting babies in incubators. And this was very common. So I just wanted to show you the world of the history of cribs. Okay. Just a little, that's like our cartoon break. Okay. So the question is, why do we want to breastfeed right away? Like you give birth, you're hungry, you want to blow your diet and have like a cheese Danish and you want to like chill out, maybe take a shower, you feel stinky. So glad that your stomach's not there. Yes, I noticed that. That's what made me think about it. We do have cheese Danish here. Okay. So one of the things it teaches is that babies eat with their mouths. So I know that seems so common to us, but for 9 months, babies have been fed by their belly button. And did you ever see that Dr. Seuss book? The little bird that comes out and is like, are you my mother looking at a cow? Are you my mother looking at a truck? So a lot of these babies have no idea they need to eat with their mouths. Even some of my home birth babies, they come out in the world, they're like, they think that they're still feeding through their belly button and they just don't want to eat. And we have to like coax them into eating. So one of the reasons of breastfeeding is like, hi, this is a world where we're going to eat through our mouths. So it also stimulates, there's 51 muscle groups in the mouth. 51 muscles that need to coordinate in order to breastfeed. And you want to start stimulating those muscles. If you don't use them, you lose them. Colostrum, which we're going to talk about, is a superpower protein that paints the intestines and gives them a coating for the rest of their lives. I think I say this also in the next slide. And 1 tablespoon of colostrum is equal to the calories of 2 ounces of formula. It's amazing. So we're breastfeeding right away, not even for the mom. That's a whole nother discussion. We're breastfeeding right away so that the baby gets the messages and stimulates the part of their brain that understands what eating is all about.
Is there something that helps make sure the mother has enough good milk?
We'll talk about that. Good question. We're going to talk about that. So here's a list of some babies that usually have trouble breastfeeding. Premature babies. If you have a baby that is anywhere more than a week early, 2 weeks, 3 weeks, 6 weeks, 9.5 out of those 10 of those babies will have trouble breastfeeding. The last reflex that comes into a baby's mouth is the suckling reflex. And if you induce a baby early because the mother has high blood pressure or the mother starts staining, that baby may not have the suckle. There's something called Perry-Robin syndrome. This is from a medical slide from it.
That baby born under 39 weeks?
Yeah, will have trouble breastfeeding. Yeah, for sure. A Down syndrome baby, they can breastfeed, but their tongues are bigger, more floppy, and don't have as much muscle structure. If a baby's tongue-tied, if a baby's weak seal, or if a baby has a suck disorder, that's an inability to coordinate, suck, swallow, breathe, or any other congenital disorders. So there are a lot of babies that right away are not going to breastfeed well. Colostrum is medicine, yes.
Do you have why a woman might not be able to breastfeed?
Yes, we're going to get into that. Question was, do we have some women who will not be able to breastfeed? Yes, we do talk about that. So colostrum, again, I consider colostrum medicine. Colostrum is the first milk that's developed in the breast. It's very, very yellow. My internet was down, so I couldn't get the color, but it says the 3-day-old milk. You see how it's still very, very, very yellow. It's a bright yellow, very, very high in carotenoids. Carotenoids are an antioxidant that's very important for the development, especially of the eyes. Remember, the baby has not been seeing things while they were inside the womb, from what our understanding is. We want the eyes to open, start focusing. That's carotenoids. That's our yellow vegetables. Those are our orange vegetables. It's very high in vitamin E. Vitamin E thins the blood and repairs any damage that the baby could have during delivery. Colostrum is filled with white blood cells and immune boosting properties. So we really want that colostrum. Now, let's say a baby goes to a NICU and gets a week of bottles or a week of formula, and women are freaking out about their colostrum. The bottom line is like this. The colostrum, which is the first milk, stays in the breasts. So even if you nurse a baby 2 weeks later, that colostrum will mix in with the breast milk and still be there. Doesn't go away. It's not absorbing anywhere. It's staying in the breast. So even if you can't nurse right away due to complications, it's no problem. So let's talk about the saliva. We're learning about our babies. So there are changes to the bacterial and viral load in the saliva. And they found that breast milk is, besides nutrients, it plays a very important role in periodontal gum disease later on, cavities, because it creates the proper pH balance in the saliva. Very interesting. And this is probably the most interesting thing you're going to learn, Michal. You're going to love this one. Maybe I taught you already. We know that the breast shoots out breast milk. Did I tell this last time? Okay, the breast shoots out breast milk. That's what it does. Boom, boom, boom. Milk is fine, right? The most amazing thing is that the breast actually inhales the baby's saliva. The breast analyzes if there's any viruses or bacteria in the baby's saliva, makes antibodies specific for that baby. What does that mean? That means that if we as the parents go into a store, kosher town, someone coughs or sneezes, I inhale someone else's bacteria or viruses. It's going to go through my lymphatic system. And in my breast milk is going to be whatever I've been exposed to. But let's say you go away for a Shabbos and it's you and a baby and tons of kids. Who's going to be kissed up the entire Shabbos weekend? It's not going to be you. Don't be offended. But it's the cute baby, the 6-year-old. I love the baby. Everyone's going to be touching the baby and drooling on the baby and giving the baby 100 million bacteria and viruses. At the end of that Shabbos weekend, what's going to happen? This baby's going to have so many microbes, so many bacteria and viruses, and the baby's going to breastfeed on your breast. The breast is going to inhale, shockingly, the saliva and make antibodies. Can you guys say wow? Wow. Wow. It's like unbelievable. Do you know what I mean? Like in Hashem's strange concepts of birthing and breastfeeding, he decided that this breast was going to inhale bacteria and make antibodies.
That's insane.
Insane. It's totally insane. Yes. Question.
Comment. I've heard that the breast milk also changes if you're nursing too. So if you have a toddler and a baby, breast milk changes according to who's nursing. I wonder if this will play a role in that as well.
I don't know. I'm not a big fan of tandem nursing. They asked, a comment was no, that if I'll tell you why, that if there's a woman that's nursing to a newborn and a toddler at the same time, that the breast milk can change. My problem with tandem nursing, just my experience, is that the toddler tends to get very manipulative and can manipulate the mom. And then the mom gets this guilt trip between the toddler and the newborn. And what my experience is that the newborn needs it. And the first one got it for however long, 9 months, 16 months, 18 months, and that the baby needs it. So I have a story where I had a woman that came in because she wanted to stop breastfeeding. And I said, why? She said, because I have to stop that 2-year-old. So I said, well, what about your 3-month-old? She goes, I can't do it anymore. I can't nurse both of them. And now I feel guilty stopping the 18-month-old when he sees the younger one breastfeed. Do you understand what I'm saying? So what I've seen in my office is that it becomes such emotional challenges. I haven't seen it ever gone smoothly. Did you nurse and have a tandem nurse?
I did not. I just know people that do and are like super pro it and super like proud to do it. But I also know that like with this specific, just the going through it was.
Right.
But it's definitely a good thing to be aware of.
I mean, I'm a big fan of breastfeeding, but I just really feel that, especially when you have a big family, those little babies get such a limited amount of time where you're one-on-one with them, that I say, Rahmana, that 6-7 months is that special time. And then there's going to be another pregnancy or another baby. So I'm just a real advocate with large families that each baby gets its due time. Just my personal experience.
So you continue to nurse a baby while you're pregnant?
Yes, you can. The question was, can you continue to nurse a baby when you're pregnant? The answer is yes, you can. I like you to quit by around 7 months. So the older baby has time to acclimate and learn how to go to sleep, how to live on their own without breastfeeding, so that the newborn can get their one-on-one time. Believe me, I want toddlers to get their attention, but it's got to just be in a different way. So milk is pretty fascinating. It's 88% water, 0.8% protein. Sometimes you have 0.9. It's got a lot of fats. So fat is good. It's got carbohydrates, which are good. And it's got 0.2% of minerals. But this is why we don't ever need to feed babies water, because the breast milk is such a high content of water. And babies, breast milk is all they really need up until they can really sit and have solids, which is anywhere between 10 and 15 months, when they have between 4 and 8 teeth. In my office, we don't feed babies any solids until they have 4 or 8 teeth, because they don't need any food. Breast milk changes and morphs as a baby's growing, and babies don't need any kind of foods. Breast milk is like mun. I don't like it until they have 4 or 8 teeth. What are they needed for? What do they need it for? So if you're going back to graduate school, getting your PhD, your husband's going to be babysitting 2 nights a week, and you don't want to pump because it's not fun to pump and your baby doesn't do well with formula and the baby's past 6 months, then maybe you can leave your husband some mushy food as long as he promises to eat it with the baby. You know what I mean? Because it's not fair that he has like something delicious, but if he'll sit down and eat the mushy food with the baby, then the two of them can bond over eating that food. But if you're not in that situation, babies explore the world. At 8, 9 months, when they start crawling, they'll eat dead cockroaches, they'll eat dirty shoes, they'll eat anything around. So they don't need food in their stomach. They're just orally excited. They just want to explore the world orally, which is completely different. So this is the experiment when you think your baby's ready to eat. Did I say this one before? No. I'll say it again. Right. So this is the experiment. You want to say, oh my gosh, the doctors tell me I need to feed the baby. Breast milk is not enough. As long as your baby can sit up straight in a high chair, this is what you do. You put some Cheerios. You put a dirty shoe with a shoelace is the best, and a brush with hair in it. Okay? Listen to what's going to happen 10 out of 10 times. Maybe one Cheerio in the mouth once, push it off the table, not worth their time. The dirty shoe with the shoelace, especially if it's been outside, even better. They're going to lick it. Disgusting. The brush with the hair in it, oh my God. Nothing is more exciting. They're going to lick it. They're going to taste it. It's horrible. Meaning they want to, it's a terrible experiment. You could be arrested from doing it 100%. But once a mother does it once, they're like, oh my God, this kid doesn't need any food and the kid does not need to eat a shoe. Right. So the point is that they're exploring. They'll eat anything around them. Mascara, they want to eat the mascara. So people will say, well, my baby's grabbing the food. Well, your baby would grab anything, a maxi pad, the shampoo, they don't care what it is. Anything you're touching is exciting for the baby. So it's important, to distinguish, is this baby hungry or is this baby exploring the world? And I know these babies are exploring the world. There's reasons to add solids, but it's not the age. It's the situation, and everybody's situation is going to be different, okay? So a woman can exclusively breastfeed a baby till 14 or 15 months old with that baby ever getting any food, depending on what's going on with the baby. And the baby will be fine and will grow and will thrive. And what's very interesting is there's immunity in breast milk from 0 to 4 months. Then it goes down because at 4 months, they're kind of really clinging to the mother. Remember in the beginning, you're going to have other people hold the baby. Then when they start to crawl, we'll talk about that. I have a slide on that. And then when they pull themselves to a stand at 15 months and start sharing toys and food with other kids, their immunity goes up even higher. So at around 15 months, the breast milk has more immunity in it than even a 4-month-old. So the breast milk molds and morphs as the baby ages. Okay. So you can't really change the vitamins and nutrient content of breast milk. Breast milk stays very consistent to the needs of the child. Remember that breast is inhaling the saliva and regulating what's going on with the baby. And so it doesn't matter whether you have a Caribbean diet, an Asian diet, a Native American diet, or a Jewish diet. The vitamins and minerals stay very, very, very consistent. What can change is the taste and smell of the milk. If you have more garlic in your diet, the breast milk will have a little bit of a garlic scent. Kids love garlic. The spices, if you put peppermint or licorice. So you can't change the vitamin and nutrient. You can change the taste. There's 3 things that you can change in the breast milk. One is the fat, but all we need is 1 tablespoon of fat. And in our typical American diets, we have way more than a tablespoon of fat. That's 1 tablespoon of mayonnaise. That's a little bit of oil with your eggs. That's a little margarine on your bread. I'm not concerned. Little olive oil in your salad. Vitamin C is a water-soluble vitamin. I'm not worried about vitamin C in our world anymore. If you were on a ship leaving World War II, being on a boat, Rahmana, for 3 months and you were breastfeeding, there could be a chance that your child would have vitamin C deficiency. So does anybody know why they used to call sailors limeys? Did anybody hear sailors? They say, oh, that limey. Okay.
So we definitely don't know why.
No, you don't know why. Never heard of it. So sailors were always called, huh?
They never had fruit.
They never had fruit. Well, what happened was they started getting sores in their mouths and they'd get different pains in their body from being out in the ocean. So they used to put crates of limes on the boat because they had a pretty good shelf life, and they would suck on the lime every day so that they didn't get scurvy and they didn't get any conditions with low vitamin C. So I'm not worried again in the typical American diet for that. And just a teaspoon of lemon juice, a teaspoon of lime juice, 3 grapes, and you're good to go. Okay. And we can change the vitamin D. Huh?
What if someone's deficient in something else? Iron or...
They'll take it out of your body. They'll take it out of your blood. The question was, what if someone's anemic or losing some iron in their body? They will take it out of your body. They'll take the iron out of your blood, take the calcium out of your bones, take all the vitamins out of them. These are the only 3 vitamins that you can influence in breast milk from the last time I researched it, and vitamin D. But if the mother takes vitamin D, it's going to go right into the breast milk as opposed to giving it to the baby directly. So you get 2 bangs for $1. You increase the vitamin D in the baby, it could increase the vitamin D in the mother. Okay. Now the structure of the breast, if it's interesting or not, I don't know. The areola does not produce breast milk. It's the lactiferous ducts. A woman has between 15 and 25 ducts inside her breast. Here's the breast. You turn it inside out. She has between 10 to 25 ducts and 10 exit holes. Some women have 35 ducts. Their kids are going to fill up faster and quicker because there's more straws. And if a woman has 15 ducts, the baby may nurse a little bit longer because she has less amount of ducts. But anywhere between 15 and 25 ducts are just perfect. So every woman has different shaped breasts, different shaped nipples, different size areolas, completely normal, okay? So I always show this slide. Did I show this to you ladies before? This is called IGT, insufficient glandular tissue. I feel an obligation to show this wherever I am. This is a condition where during adolescence, women's breasts did not grow properly. They are missing ducts inside their breast. Instead of having 15 to 25, they could have 3 or 4. There's no test for it. There's no sonogram for it. We know it by the shape. So here's the example. We're running the marathon, all of us. We're in really good shape. We get to the drinking station. We have 1 minute to drink every mile. I have a cup of water with 8 straws. You guys have cups of water with 3 straws. Who's going to be thirsty after 5 minutes or 1 minute of drinking? You, not me. We run another mile. We get to the drink station. I get 8 straws. You get 3 straws. 1 minute to drink. At the end of the race, I'm hydrated and you guys are not. That's kind of how it is with kids. For women that have IGT, insufficient glandular tissue, they're missing straws. The quality of the breast milk is the same, but the amount is not the same. And this is a sakana. You can see the triangle shape to the breast. You can see they're wider apart on the body. You can see one breast is significantly larger than the other. This does tend to grow each pregnancy. More ducts are grown. If I went back to get my PhD, which I don't know if I can afford, but if I did, I would do it studies on IGT, insufficient glandular tissue. It's not known in the world. Your doctors are not going to know about it. Your midwives are not going to know about it. And everybody should know about it. So you can diagnose it. It's much more common. The question was, how common is it? Much more than I ever thought. When I learned a long time ago breastfeeding, they said that less than 1% of the world has it. But no way, Jose. I probably see anywhere from 2 to 4 cases per month in my office. I believe it's much higher in the Ashkenazi Jewish world. I think it's from intermarrying. That's my opinion on it. Maybe. It's a big fat maybe. I just had a woman that came into my office and she brought her youngest daughter. And I had seen one of her other daughters 16 years ago. Okay. This was a bubby. The mother looked like a bubby. I mean, she must have had this child, close to 50. I don't know. She was an older lady. She said, "Oh, do you remember 16 years ago?" I'm like, I don't remember 6 minutes ago. Tell me the story. 16 years ago, I told her daughter that she had IGT. She was very angry with me, which I understand. She was very, very depressed, tried to breastfeed her baby, didn't listen to my advice, no problem. Second baby went to another lactation consultant named Rifki Schwartz. She's also a good lactation consultant. And she said, by the way, I want to let you know you have what is called IGT, insufficient glandular tissue. So she was really upset with Rifki Schwartz also, which I understand. It's not a pretty diagnosis. And it turned out that by baby number 5, she went back and took my advice. She used what was called an SNS, a supplemental nursing system, which is a tube you wear down the breast. I'm sorry, she's up to what number? Her last 3 kids, she's been finally made peace with it. So this is not a great diagnosis, and it's really hard for some people. And some people's, I didn't bring it with me. It's a little tube that you wear down your breast. So you have a bottle that you wear around your neck, and it's a little tube, and the baby gets formula and breast milk at the same time. Because with IGT, the quality of the breast milk, no, be depressed. Davin, give extra duct. I don't know, but there's nothing really that's going to change it. No, it's like missing toes. It's like being born with 3 toes. You can eat and take 100 supplements, go to acupuncture, do cranial sacral, and you're not really going to get more toes. Okay, so that's a problem that we have 100%. Okay, but with some babies, it does seem to grow with some women as they have more kids. It does. There's just no clinical data until someone finances my PhD, and then I can do all the data on it. No problem. Just there's not enough information out there. Okay, so baby stools are really, really, really important to be aware of. The first day, the meconium is the first stool that comes out of a baby's body, and it's black. It's black to brown, but mostly black. That's what's inside the womb for the 9 months that the baby, as the baby's developing, the end of the trimester, during the last trimester. When you mix it with breast milk, the meconium starts to turn to brown. When you get more breast milk, black and yellow make a green color. Then the 5th day, it's a dark yellow. Well, I really like it. I've really changed since I made this slide way back when. But if you have a boy that's yellow and you want him to have his bris on time, he needs to start having bright yellow stools by day 3. So I really push fluids on these babies. The more meconium that's in the body for a longer period of time, the more yellow the skin will be. So I've really changed from this slide many years ago, and I really push those babies. So the baby comes to me day 5 in my office and that baby's yellow, I can bet you $1,000 that the stools are still brown to green. And if I have a little boy that comes into me and he's not yellow on day 3, his stools are already going to be yellow. So basically, this is the transition from black to brown to green to yellow. But I mean, the 4th day is the last day that I want to see any brown in there. Breast milk or formula, depends on what's going on with the baby. Yeah, we just need to feed them tons and tons and tons. Yes, yes, yes. Right. We don't want to give the babies water, though. Yeah, exactly. Yeah. We don't give babies water because water stimulates the kidneys and protein stimulate the liver, and the meconium comes from the liver. Okay. How to increase and decrease milk. Interesting that I put this slide in here. So basically, this was for another lecture that I did. Breast milk is made, we don't pump. I don't pump in my office almost ever. And I'm not an advocate of pumping. I want to use the baby's mouth. A baby's mouth is warm, wet, and soft, and a pump is hard, cold, and plastic. So we get babies really to breastfeed quite proficiently when they come in my office. This was a slide I used for herbalists. Fenugreek actually balances blood sugar. Goat's root balances blood sugar. These herbs are not necessarily going to increase your breast milk. If someone comes to me and they feel like they have low milk supply, what we're going to do is we're going to treat the mother and see what's going on with the mother. So alfalfa is just if she's low in vitamins. Shatavari is if she had some fertility issues. Chaseberry is also for people that had fertility issues. Burr's yeast. I went over what was on the internet about increasing your milk. Because a lot of my clients had a lot of fertility issues before they give birth. Sometimes my clients have IVF, in vitro fertilization. Some of my babies, so if she had a history of hormonal imbalances, I, as an herbalist, may give her an herb like chasteberry to balance her hormones, because I'm concerned that we had problems with them before. So I personally take a history and find out. If she had very erratic, very irregular periods, took her 5 years to get pregnant, and we know it's not the husband, then I'm going to work very quickly to balance her hormones the best as I can during her breastfeeding experience. Burr's yeast will not increase your milk. It just has a lot of B vitamins in it. Fennel helps with digestion. Morgana has vitamins, nutrients, and iron. And sage is the most important herb, chas v'shalom, if someone loses a baby. If someone gives birth to a stillborn or loses a baby, Rahmana, sage is an herb that can dry up their breast milk within 24 to 36 hours. And I have this, unfortunately, more than I want in my office. Beer does not. Good question. The question was, does beer do anything? And the answer is no. It really does not increase your breast milk. The reason they used to Tsugazun, give beer to women, is because it's got an herb called hops. Hops is calming and soothing to the system. It kind of takes the edge off panic and anxiety. So the thought was that if women are nervous about not having enough breast milk, nervous about not being able to be there for their kids, if you give them some beer, the hops in it will calm you down. So beer does not increase breast milk. There's no such thing, in my opinion, as a breast infection. It used to be called a milk fever. When you get a milk fever while breastfeeding, it just means you're not managing your breastfeeding properly. Sometimes we get abscesses in the breast, which is not really for this discussion right now. But the most important thing to know is that you put ice on a swollen breast, never heat. Heat will increase breast milk, make you have more breast milk. And if you have a swollen over here, what do you do if you twist your ankle? You put ice on it. If you bang your arm, you get an injection, you put ice on it. So we want to put ice on any swelling of the breast. We can also use what is called cabbage, or not what's called cabbage. I would say potato poultice, but you can take a cabbage leaf, crunch it in your hand, green cabbage, not purple, put it in your bra. It will reduce the inflammation. And I like to make a potato poultice. I actually take a potato and grate it, put it in a what kind of a bag? Like a cotton muslin bag. We put it in the bra or an old knee-high, and it'll reduce the inflammation. It's actually remarkable for swollen breasts.
Can I just say that?
Yeah. Baruch Hashem, sure.
Literally, from my husband's like with the cholesterol right now.
Right.
So much.
Right.
I was about to pass out. I called Sara Chana. She's like, beautiful. All of these things within maybe an hour or two, I was a normal human being. I mean,
Right.
it's not to work on it.
Right.
Right.
Right. You put ice.
Yeah.
Yeah.
We said ice.
Potato poultice.
And
What else do we do? And the
maybe some homeopathic.
probably homeopathic also. So this, yeah, it's caused when, honestly, that the baby's on the breast, hanging out there, using you like a human pacifier, not really transferring the milk, and the milk is coming in and coming in and coming in, and then the baby finally goes to sleep, and you're filled with this breast. So then the breast causes swelling to the tissue, or some women have what is called a fast MER, or milk ejection reflex, and the milk just comes in, and they have like lightning, tons of milk, just tons of milk, and actually you have to teach the woman's body to slow down on the milk. So she'll just be stuck with breast. And what happens is, the reason you get a fever is because it's called a milk fever, because when the body heats up to a certain degree, the body will reabsorb the fluid. So here's an example. You have a cup of water. It's okay, sure. You have go get whatever you want. You have a cup of water. You put it on your fire escape. It's 90 degrees outside. The water's not going to reabsorb so quickly. If you put a cup of water in your fire escape and it's 105 degrees, the water will evaporate almost instantly. So the body makes a fever so that the body can reabsorb and get rid of the excess fluid in the breast. So it's called a milk fever, not an infection. Okay. A plugged duct. Let me see what else I have here. Okay. Let's just go very quickly through this. So we have a plugged duct. A plugged duct is different than a milk fever. It's really caused by something, a fat that the woman's not breaking down very well. We're going to do a blood type lecture at some point. So blood type Bs will get a plugged duct from eating chicken. Blood type Os will get a plugged duct from eating too much dairy. Blood type A will get a clogged duct from eating too much milk and tomatoes, potatoes, eggplant, or cabbage. And blood type ABs need a little bit more of a vegetarian diet. So a true plug in the duct is from a fat that the mother's not breaking down. It's the same fat you're going to see on the lining of the arteries and the heart. So it's very important. Fats are we can do also another lecture on the brain. The brain does very well with fats. We need good fats. Our brain health will increase when we have good fats. So we want to make sure we don't have bad fats. So when women come into me with a plugged duct, I'm always like, you're here so you don't get heart disease, Rahmana. You're here so you don't get a fatty liver. Because for me, a plug in the duct is just a symptom that we have to treat something else. Yeast. Huh? Oh, you'll just feel it kills here. It just kills right here. The rest is fine. It's killing me right here. You'll feel it. Just this area is killing you and everything else is fine. Yeah.
Always or just one thing?
Usually a lot, all the time. You're like, I can't get rid of it right here, Sara Chana. I wake up with it. I go to sleep with it and it's just not resolving right here. Okay. So a yeast infection vaginally and a ductal yeast infection, an undiagnosed yeast infection is the #2 reason why women stop breastfeeding in the US today. You don't see yeast on the nipple. You don't have to see thrush in the baby's mouth. Here's the breast. If I could turn the breast inside out, this is where yeast grows, right here on the inside. It grows here. So you can't see it. You can feel it if there's any burning, biting, sharp shooting, stinging pain. Yes, certain blood types have more of a propensity towards it. ABs, yes. You don't see it. You just feel it. A lot of women, totally safe to nurse. The question was, is it safe to nurse? But it's painful. Any burning, biting, sharp shooting, stinging, pulling, tugging pains. You don't need to see thrush in the baby's mouth, but it is something we need to treat both the mother and the baby for. Diaper rations, yeah. Sometimes you can get it vaginally and sometimes you can get it in the.
These herbs are all good for it.
Yes.
Regardless where it is, do you buy it like?
You take it internally, drink it internally. Those. Yes, yeast is a fungus. We always have fungi in our body at all times. We all have yeast in our body, and we just want to balance it and make sure it doesn't get out of hand. Okay. Right. So we treat it topically for the mother and the baby. It's a 14-day treatment. And then we'll use herbs to treat it internally also if it's more chronic. Some people get it chronic. So diaper rashes, babies shouldn't have a diaper rash. If they do, we want to treat it very quickly. Sometimes it can be a bacterial infection they pick up in the hospital. Sometimes the baby can be allergic to the diapers. A baby could also be allergic to the wipes. My favorite thing is green clay. You see up there in the corner is French green clay. We just put the clay over. We don't make it into a paste. We just sprinkle it like powder. And that usually clears up these diaper rashes very quickly. It's called French green clay. Very often, if we don't see yeast in the baby's mouth, red clay is different. That's a good question. The question was, how is it different than red clay? Red clay is different than white clay. White clay is different than green clay. Most red clay comes out of Morocco. It's called Moroccan red clay, and they get it right out of the ground. And then we get French green clay, which is really momish from France. So I use green clay in a different way than red clay. Red clay I use a lot, although I just put it on the baby's diaper today, but usually I use the green clay because there's usually a fungal infection involved, but because I think there's some bacteria, I gave the red clay today. I also use red clay with poison ivy or poison oak. I had a client and you could, yeah. It's a little more messy and stains a little more, so I would go with the green that doesn't stain. But I had a guy, Shabbos guest, not married, very much available, great guy. And he's like a big hiker and he's an adventure seeker. And somehow he just got into a patch of poison ivy and it was all up his legs and he had done everything. And he actually made green clay into a paste and within 24 hours felt better. So it really can work on those kind of, you can buy it online. Green clay you can buy on Kingston.
You were mentioning that if you don't catch the yeast on,
yeah,
so then you might see it
on the tush. So sometimes if we don't see yeast in the baby's mouth, but the mother has nipple pain, we'll just see a diaper rash on the baby. So the mouth is connected to the bottom part. So we'll either see a rash in the bottom part or up in the baby's mouth. So let's talk about a normal feeding schedule for babies. We're jumping back to breastfeeding. They nurse every 1 to 3 hours from the end of the feed. Never count from the beginning of the feed. None of us in this room are full until we finish our feed. Doctors will tell you to count from the beginning of the feed, but I'm not full until I finish my meal, okay? No night training for the first 2 years. Babies are on a 24-hour schedule for the first 2 years of their life. It's definitely hard. That's the way Hashem made it. But Shulchan Aruch says you can nurse a baby till age 4 if they're healthy, and until age 5 if they're unhealthy. And the Chachamim say the minimum age of breastfeeding is 24 months, minimum, not maximum. So we're like really pro breastfeeding for a very long period of time. Babies can go through growth spurts at 3 weeks, 6 weeks, and 3 months. And breastfeeding should not take longer than 10 minutes by 6 weeks. A baby should be able to fill up their entire tummy in between 6 and 10 minutes by 6 weeks. But we in my office train those. The question was that we feed babies until they're full. But in my office, we're very OCD about teaching those babies to nurse quickly and efficiently. And I believe that almost all babies can be trained to eat quickly. I think them hanging out, using you like a human pacifier, it doesn't accomplish anything. Mothers go crazy, babies waste mom's times, and I don't believe we have to do non-nutritive sucking on the breast. A big advocate of that. My clients nurse a long time. My clients nurse for a long time, and most women breastfeed for about 6 weeks in the US and then quit. The statistical rate of breastfeeding, the last I looked it up in the US, was less than 20% of women nurse past 6 weeks nationwide. In the firm community, we have about a 95% success rate. Baruch Hashem. Yeah, we're very high on that. And babies should not be on a schedule ever, because we are not time bound by mitzvahs. Even if we have to go to the mikveh, if our husband's in Eretz Yisrael, we're going to push off the mikveh. And even when we light candles, I don't know about you guys, but the ringer goes off 18 minutes before. It goes off when it's time to light, and then we still have 18 minutes, right? So we have this big time frame with which to light our candles, because women don't work well on schedules. Now, if you have your personal trainer coming every Monday, Wednesday, Friday at your house from 10 to 11, you could always feed your baby at 9:30 and your baby will acclimate to your schedule. But then if your trainer goes out of town for 2 weeks, you'll go back to whatever schedule that you and the baby want. So we can schedule our lives, but we're not supposed to schedule our babies. That's a very important thing. Huh?
If you're getting the baby used to you feeding at 9:30, then that's
because you want to be fluid. And I want to use that word in a positive way. You want to be fluid to like mess up that schedule. Go to Florida for a weekend. Go Erev Pesach somewhere fun. So what that means is that if you are working Monday through Thursday, you're teaching at a local girls' school from 9 to 1, your baby's going to be used to eating before you work, maybe one bottle during the work time and then nurse right away. But that means that you don't have to have the same schedule on Friday, Shabbos, and Sunday. The more erratic our schedules are with breastfeeding, the longer we'll stay clean. So you can have a schedule, clean and not get your period right away, right? The more erratic our schedules are with breastfeeding, even if you're at work pumping, you don't want to pump every day at 10 o'clock. You want to do it one day at 10:15, one day at 9:45, one day at 12. You want to erratically pump. Yes, and because babies are erratic. You never know. Like, have you ever eaten the same amount of food at the same time every day, 3 days in a row? Never. Even if you have oatmeal every morning, sometimes you eat half of it, sometimes you eat 2 bowls of oatmeal. Makes sense. With your coffee, sometimes you drink the whole cup. Sometimes it takes you an hour to drink it. Sometimes you know what I mean? We're very, even if we're scheduled in a very non-scheduled way. And that's why I don't like when babies eat at 9, 11, 1, 3, because that's not how human bodies work. And that's not how we work in our lives. Yes, question?
1 to 3 hours is like from what's considered newborn.
Newborn is every 1 to 3 hours from the end of the feed.
What's considered newborn?
This is newborn.
What is considered newborn? So what age? How many weeks?
2 years.
For 2 years, they eat 1 to 3 every.
Yeah. Sometimes it'll be 3 hours. Sometimes it'll be 2. Sometimes you'll get a 4-hour break, but it's no, because the baby will talk to you. You'll
Maybe
talk.
we'll start crying when it's hungry.
Yeah. So I wish that we had little ounces on our breast and a see-through window in the baby's stomach. It would be so amazing. But Hashem wants us, would be amazing. I know if I was in charge of the world, you could vote for me. I would definitely do that, right? But no one asked my opinion. But Hashem wants us to intuitively feel when our children need it. It's a hard thing.
2 years old also every 1 to 3 hours?
Depends. Sometimes 2-year-olds can go 5-6 hours without eating. Everybody's going to be different at that point. You've got toddlers that are big eaters and you have toddlers that are picky eaters and eat 3 Cheerios. The next kid will eat 4 bowls of cereal. So around 2, their personalities, their DNA, their genetic really starts to come out. Okay. So different babies, back to our lecture, which is about babies, have different mouths. We can have high palates, bubble palates, clenching of the jaw. Babies can be high tone. They can have an overbite. They can be low tone. They can have a tight frenulum. They can have a weak seal. They can have low tone. So basically, these are all the different variables that our babies are born with. A high palate is the roof of their mouth is very high. Some babies are born like this. They had a very difficult delivery and they're clenching their jaw. Some babies are high tone, which means that they're very, very, very tight. Other babies are low tone, which means they're very floppy. A lot of my babies this week have had overbites, very, very big overbites. And I tell the women, I'm like, put aside for braces now. They're like, my baby's a week old. I said, I'm telling you, your baby's going to need braces because the bite needs to be like this. This is the top, this is the bottom. And when these babies come in like this, they have trouble breastfeeding. They really are going to need dental work down the line. So these are just things that a good lactation consultant can judge in 1 second. They slip off the breast. We latch them on, they slip off. And it's very hard to get babies with weak seals to breastfeed well. They need a lot of therapy. Someone like me as a lactation consultant is going to do a lot of therapy on those babies. I'll teach you exactly what to do, but they're not going to be good nurses right away. This is a tight frenulum. This is very hard to breastfeed. Have we seen pictures like this before? This is the little cord under the tongue. This needs to be clipped. It's called tongue tie. Now in the frum world, it's very, very fatty to get your tongue clipped. It's a shanda what's going on. People right now are taking complete advantage of the frum women. They're buying homes in the Poconos, Florida, Israel, Long Island, because every baby born has a tight frenulum. No. So there's a big movement in the frum world where they're clipping the lip, the cheeks, and the tongue. And it's not true. This is called a midline defect. A boy that has a tight frenulum in his penis area will have extra tissue. It's called a midline defect. In the litfish world, before they do the bris the week before, they pull back the foreskin. And your moil will tell you your baby has a tongue tie by seeing the way it folds back. Our Hasidim, in my opinion, are a little lazy. They don't do it for whatever reason. They just do the bris and they're not going to see it. But this is a midline defect. I do not believe that 99% of our Jewish world has a midline defect. So don't fall into this. This is a real tongue tie. This needs to be clipped. If we gave birth back in a shtetl with a midwife that was brilliant like me, someone that knew what they were doing, we would have clipped this right away. We wouldn't even have asked the woman. Just like no one's going to ask you if they can clip the cord, they're not going to ask you. They're just going to take care of it. This is a real thing. A lot of these doctors are now saying, well, it's a hidden tongue tie. It's a posterior tongue tie. Those do exist. Well, they take a laser. and they laser the lip and they laser the tongue and they laser the cheeks. It's a disaster what's going on. It's a disaster. It goes in too deep. Babies cry a lot. And I just don't think we need to violate babies' mouths unless we need to. Do you know what I mean? Why cause it? Right. So this is a heart-shaped tongue. This is another tongue tie that's real. The first baby will have trouble saying lamed, love. That's why I want to clip it. And the most important word for a child is lollipop. Much more important than a mom. What? Lollipop. And
if they can't say the lamed, it's because of the tongue tie?
a lot of times they'll say lollipop. I love you. And what? Galuga. Exactly. Maybe there's a tongue tie under there. There could, yeah, it's got to go up. Lollipop. Here's another one. This tongue needs to be clipped. I'm just showing you because this is a real thing. This is the normal range of an adult tongue. And this is an adult with tongue tie. This is easy to remedy as a child. Easy. Okay, so let's just take a couple more minutes very quickly. Since we're learning about babies, we're also going to learn about women for just 5 minutes, of course. This is a flat nipple. This is harder to latch a baby on. If you don't have an epidural and are not induced, most lactation consultants can help you get a baby on even with a flat nipple. This is an inverted nipple. This is where the nipple goes inside the body. This is hard to get a baby on. So, you know, when you hear a woman saying she's having difficulty breastfeeding, she probably has one of these conditions: tongue tie for the baby, flat nipple, inverted nipple for sure, and they need help. No question about it. It's not a weakness to need help with a lactation consultant. It's a strength to ask for it.
Does this change?
No, they can pull out. The flat nipples can pull out a bit, but these inverted nipples don't pull out usually so well. You use it. Well, I'm going to show you next. So here's a nipple shield. A nipple shield is a great idea. This is a shield that you put on your body and it makes a fake nipple, and it's phenomenal for babies that have these problems. It's not for sore nipples, but if you have a flat or inverted nipple, I want everyone walking in the hospital with a nipple shield. Why should the babies cry all day, all night? Why should the women feel frustrated? I'm just showing this to you. There are different shaped shields. Either your nipple, it's not the areola, it's determined by the shape of the tip of the nipple. The tip of the nipple can be the size of a eraser of a pencil, or it can be a dime, a nickel, or a quarter. So we have 3 different nipple sizes, and I'm just showing you the different shapes. I only use the one on the bottom. I only like the one on the bottom because it stays on better. We also have very long nipples. And when we have long nipples like this, the baby latches on the nipple like a cigar, and they just bite and chew and they rip these things to shred. So we have these flat nipples, we have these inverted nipples, and we have these really long nipples. So if you have a long nipple like this, you have to bring the baby on so that the baby's mouth is on the breast tissue, not the nipple. So this is as big of a problem as a flat nipple, just sharing with you. We have large areolas. All resolved, huh? The areola is, well, it's a bullet. I mean, it's like a bullseye, so the baby knows where to latch onto. It has little bumps on it called Montgomery glands, which cleanses the area. And it's this is actually stretchy like the tissue inside our womb. When our womb stretches, when we're pregnant, we can be nauseous, headache, not feeling good, but you don't feel your stomach stretching. Is that interesting? It's not like, oh, wow, I feel my stomach stretching. It just stretches. So the areola is also stretchy. So this is a woman, there used to be what I call the areola lie, where doctors used to say you have to get the whole areola in the baby's mouth. Well, this baby we'd have to call Hatsala, because this baby would be choking. Do you know what I mean? The mother would be going like this. I'm trying the whole areola, help. And the baby's like, I mean, it's like a crisis. Do you know what I mean? So this is a woman that got really bad advice. The whole areola is not going to fit in the baby's mouth, right? And here's also a crisis, because this is a tiny areola. So the woman latches the baby on like this. barely on, and the baby's also going to hang off this nipple. So the areola doesn't really matter what size it is. It's all about getting the baby's lip on the breast tissue. The nipple goes in the back of the throat, and it's kind of like this. Here's the nipple. Here's how the baby latches on. Do you see? So the baby latches on like this, bottom lip, top lip, and off. So it doesn't matter really whether you have a long nipple or a short nipple or a flat nipple or an inverted nipple, because we're going to problem solve and figure it out. But this is why some people have no problems and other people have problems. When you're breastfeeding the baby, no matter what size this nipple is, you're going to get the baby's bottom lip before top lip. Do you see that? It's bottom top. Do you see? That's what we're doing. So that's why we, no matter what the shape of the breast is, okay, here's my next prop. You guys are going to laugh too. So watch me. If you want to get both pieces of bread, it's like after Pesach, you're starving. All you care about in the world is bread. You're going to compress your hamburger and watch. I have to get the bottom lip on first. Watch. Do you see that? It's the structure of the jaw. If I try to go forward, the lips get in the way. So it's the same thing here with the breast. Where's my fake breast now? My fake breast is like this. That's why with a short nipple, long nipple, inverted nipple, it's all about bottom top. Do you see that? It depends, exactly. So I'm just giving you different scenarios so we all can be familiar that everybody's nipples are going to be different. Everybody, her right nipple could be different than her left nipple, and the baby's mouth can be different. Yes. So here's baby's opening wide for the latch. And you see, I like the top of the areola sticking out. Do you see how the baby's chin is pressed into the breast? Do you see how the cheeks are pressed into the breast? And you see how the nose is away from the breast? This is a good latch. And this is a baby that's going to transfer milk very well. This is a baby that's going to be in great shape. Sometimes if we have a very large breast, we can do what is called the sandwich, where we smash the breast like this. But you see how the baby's mouth is open wide. Do you see that? Doesn't even matter what kind of nipple is underneath it. So I want babies very, very close. Again, we spoke about skin to skin earlier. So besides when a baby is first born, that skin to skin, this is skin to skin too. This is the baby's cheeks and chin up against the skin. So we're getting skin to skin contact the whole time you're breastfeeding, even without being completely naked. Do you know what I'm saying? So the whole naked skin to skin thing, I mean, it's got some positive, but really this is enough as long as that baby's in close. This is a bad feed. This is a woman who's going to have pain on her nipple. The baby's nursing like this. And this is also a bad feed, a bad latch. Oh, that was kind of cute how that changed like that. This is a baby that's a bit too close and we can't breathe. That head has to be tilted back a little bit. And here's like, where's that upper lip? So what this woman did, just to let you know, I know exactly how she latched the baby. She went like this. She brought the baby in like this. And that top lip got caught under. If you do bottom top with the latch, the lips are automatically open. You don't need to open the lips. It'll do it by itself naturally. Do my hamburger latch. And that top lip can't curve in on itself. It can't. I mean, you can't, it's not a normal behavior. If you're going like this, the normal behavior is that that top lip is going to stay open naturally. Okay, let's see. This is another great asymmetrical latch. I brought this picture back again to see. You saw the bad ones and you saw the good ones. We're almost done. We're going to go very quickly. A good feed is 450 swallows. It's not how long the baby's on the breast. It's how active the baby is. When you have a baby that's nursing well, they do 60 to 100 swallows, pause, 60 to 100 swallows, take a break, 60 to 100 swallows, pause. It's 450 swallows per feed. Let's just talk very quickly about this, and then we're going to go to questions and end soon. So at 6 weeks, the woman's body transitions from what is called the endocrine system to the autocrine system. The endocrine system, the body lets down milk, even if the woman's not so smart, even if the baby's not so smart. Hashem keeps on letting the milk let down. But by 6 weeks, a woman back in a shtetl had to go back to washing her clothes down by the river, hanging up her laundry, making fires in her house, going and milking the cows or getting the eggs. So we couldn't have our breast tube full with milk. So by 6 weeks, we go back. We're not a kimpetor. Being a kimpetor is the first 30 days postpartum. And by 6 weeks, we need to be able to go out and use our arms so our breasts go back to normal shape and sizes. Around 6 weeks, babies may have less stools. Women's breasts do not feel full. A lot of women freak out that at 6 weeks, the baby could be going through a growth spurt. And around 6, 7 weeks, women start to feel that they're back to themselves. We're going to just talk about pumping for 20 seconds. I'm not a big fan of pumping, but if women need to go back to work, pumping, it's very important to make sure that you have the right flange size. There are 4 flange sizes, well, actually 5 on the market, 4 easy to get. And you want to try different flange sizes, just like different women have different shoe sizes. Very important. So don't just use the flange that comes in your pump. You can buy them online. They're very inexpensive. They're like $10 a piece, and it can really save you. You're going to see which one fits better and feels comfortable. Here is how to correctly size your flange. And we are done. We're going to open up for questions. And we've got, Michal, some questions over there. So I hope this was a little bit of a good introduction to babies and newborns and getting a little more comfortable with who they are and what they are, not being intimidated by yellow in their eyes or on their skin or just the different transitions if the skin gets dry. I think one of the most important lessons for me is to know that women's breasts are different sizes, their areolas are different sizes, babies' mouths are different. So there's certain rules about breastfeeding and babies. They need to eat every 1 to 3 hours. We want to see 6 to 8 wet diapers in a 24-hour period. Babies should be healthy. But then after these general rules, everybody's different. Women's breasts are different. Babies' mouths are different. So I just wanted to make sure that everyone gets a little bit familiar with what a baby is, especially those skin transitions can be really the cradle cap we went over, the different rashes. And we're going to open up to some questions. Is there any questions in the room? And then we're going to start opening up to questions. You want to do it here? No problem. Any other questions? Yes. The question was, how do you put the baby on properly? And that's an asymmetrical latch. This is the baby's mouth. This is the breast. It's bottom top. You always want to bring the baby's bottom lip on first.
Like, do they have their mouth wide open or something?
Yeah. You tap their bottom lip until they open wide, bring them back, and you ram them on like a maniac. Because otherwise they're going to bite the tip of your nipple. It's really fast. You can move it anyway. You tap the baby's bottom lip till the baby opens wide, bring that baby back and bring that baby on quickly and deeply. This is not dangerous. Shaken baby syndrome is when you colostrum take a baby and start screaming and their head goes back and forth. That's very dangerous. This is a whoop one, and I'm supporting their back, so I'm not concerned about it.
Especially because you spoke about the whole, like the
back. Yes, yeah. Exactly. Okay, great. Questions online. Skin to skin is the most important the first week or in general. And so we answered that. That's Yehudis. Thank you. We said that the skin can skin if your breastfeeding will continue the whole breastfeeding experience. Okay.
What about cute newborn pictures? Vernix isn't pretty.
Vernix is not pretty. I agree with you. So I wouldn't take pictures the first week. Yeah, exactly. She said, send me the pictures and I'll have them for my talk. But
it doesn't usually stay on.
Yeah, no, your body will absorb it very, very quickly. The baby's body. It's not going to stay there as long. But if it does, it means So what happens is if the baby needs it, it'll stay there longer. If the baby doesn't need it, the body will absorb it right away. So for your pictures, it could be gone in 48 hours. Is tummy time bad, Yehudis? No, it's not bad. It just depends on how the baby reacts to it. When they put the baby on the tummy and their face is like smushed, it's like a Rahmana. You really want them to be able to lift up and or reach for toys. So tummy time is not bad. It just, every kid's going to be a little bit different.
Does the bottle also teach an exercise?
No. So Goldberg, does the bottle teach exercises to build the muscles? No, a bottle is a terrible idea in the first 6 weeks of life. I didn't bring a bottle with me, but in order to drink with a bottle, babies bite. They bite the tip of the nipple, and with breastfeeding, their tongue is flat like a piece of wood. It's not, most babies can't do breast and bottle in the first 6 weeks of life. Here, I have this, look, like this. Hold on. How's that? Okay. The question is, would chasteberry be used to treat postpartum depression? And the answer is no. I would use more motherwort, skull cap, or rhodiola. Chasteberry is used just to help regulate the hormones, but chasteberry I would only give if I felt that the woman had fertility issues or hormonal issues, but not emotional. Question is, why can't babies be trained? I've heard that it can work. I feel like I can't. Okay, sleep till they're 2. So women are supposed to, it says in the Shulchan Aruch that you can nurse a baby until age 4 if they're healthy, and until age 5 if they're unhealthy. And the Chachamim say the minimum age of breastfeeding is 24 months. So when we sleep train babies at 6 or 7 months, we don't stay clean and we have another baby sooner, even if you go on birth control. So Yehudis, every situation is going to be different. We'd have to discuss it, but basically it's as important for a woman's body. Very interesting. I got a letter from the Rebbe. I should have brought it here. I didn't get a letter. I'm sorry. A woman put a letter under my door from the Rebbe written in the 1950s. And the woman wanted a bracha to not breastfeed her baby because she has sensitive nipples. So the Rebbe wrote back in the 1950s that breastfeeding a baby is very, very important. And he writes 2 varies. And he says, even today, this is a sense of humor, today, even American doctors, he says, have begun to understand how important it is, and here's the key word, for the mother and the baby. And the Rebbe wrote mother first. I mean, how bizarre is that? If I was convincing someone, I'd say it's so good for the baby. It's so good for the baby. He's like, forget the baby for a minute. It's good for the mother and then the baby. And he said, and as you're saying that you're sensitive, he said, it's normal to breastfeed. Hashem made man right. So basically the Rebbe said, get over it and get some help. So very interesting. So if you need to sleep train your baby, that's a personal decision. But before 15 months, I think babies need to nurse at night. Okay. What do you suggest for women who lose a lot of weight from nursing? I want to lose a lot of weight from nursing. Oh my gosh, if you could package it, you become a multi-billionaire. So I never lost a lot of weight while breastfeeding. You did? Okay. Well, you really have to have a lot of good protein and a lot of good nutrients. And that's something, there we go. Blackstrap molasses. Yeah. That's something we could talk about individually, but it's not as common. Putting dandelion leaf oil on a skin tag near the eye. Dandelion leaf. Yes, you could. That would be totally safe. Sorry, does a bottle also teach breastfeed? No, we didn't. Okay. Let's do.
There we go.
Okay. Yes, dandelion oil on a skin tag. Great idea.
No, there's the rest of the question.
Should one use dandelion oil with alcohol or not? No, it should not be bought in tincture form. Dandelion oil. It's dandelion flowers. It's the oil made from the flower, and it should not be with alcohol. And you can get it from either Healing Spirit Farm or Woodland Essence. Those are the 2 places that sell it. So the question is, what do you do if a newborn stays on the breast forever, doesn't latch off, was told he needs a posterior tongue tie cut, and I'm so emotional about it. So a baby can be trained to fill up their tummy in 6 to 10 minutes. It means that your baby needs suck training. And Miriam, you can send me pictures of your baby crying. I'm not such a fan of posterior tongue ties being clipped. Sometimes we clip them, but I'd have to see it. It's overdiagnosed and it's overly done. Yes. Okay, let's see. Question: what happens if a baby doesn't have more than 2 teeth past 16 months? When do you start solids? I mean, you can add like a poo-poo platter of food. You could definitely put some food down on the high chair and let them play with food and experiment with different tastes and different textures. But I don't think that baby needs food in their stomach. Yes. I mean, when they have when the question was, when do you add food? We don't do it till they have 2 or 4 teeth because they need to break it down.
But it doesn't give them away from breastfeeding.
Yeah, but if you're like 14 months and you haven't gotten your period yet, I wouldn't say introduce solids because you're going to turn around and get your period. So you have to decide for yourself and see the dynamics of the family. Yes.
Not all women will breastfeed.
True. Well, the question was, not all women breastfeed clean, and it is true. A lot has to do with your food, a lot has to do with your DNA genetics, but the first 6 weeks are the most important. No pacifiers, no relief bottles. Go become in a symbiotic relationship between mother and baby, and you'll be able to stay clean longer. Those are the rules. Okay, next question. What if you can't eat enough to keep up with nourishing the mother to the baby? So you only need like 1 extra sandwich a day and maybe a half a cup of water. So you're supposed to just eat normally when you're breastfeeding. You don't even have to really increase your nutrients. So just make sure that you're eating dense nutrient foods, like 2 tablespoons of a soup is better than a bag of chips. 2 tablespoons of a smoothie is better than, you know what I mean? Like empty carbs. Have nutritive dense foods. Do you suggest to use 1 side at a time each feeding, or use half the time? That depends on the baby. If the baby's a really good nurser and can transfer the milk very well and coordinate suck, swallow, breathe, some women may need only 1 breast per feed. If the baby's, you know, spacing out, speaking to malachim, thinking about what they want to be when they grow up, then you may have to switch the baby to the other side to wake that baby up and restart their system. So that really depends on the baby. You can read this one, Michal. Go.
Any suggestions for a mother who experiences decrease in appetite after birth?
Yeah, small bites of dense nutrient foods. And make sure you're taking milk thistle during the pregnancy, which we discussed. Okay, you can't see it in this light. There we go. Milk thistle is really great because that'll help clear the liver. And most people that don't have that appetite have a bit of a congested liver.
Mm-hmm. Not sure if it was mentioned, but what happens when you have another baby, when your first baby is only 12 months or below 24 months? Do you continue breastfeeding the first one?
We spoke about it. I'm not a big fan of tandem nursing. I want each baby to get their time and their energy. So I'm not a self-reminder. So I'm not I love it. So I'm not the biggest fan of that. To me, I'm not the biggest fan. Huh? When the question is, what about breastfeeding while pregnant? I would say you can go till your 7th month easily. Easily, yeah. Yeah. Anything else, or is that the end of it?
My baby is 4 months old and doesn't cry in the middle of the night to eat. Should I wake him up?
No. If you have a bracha that your baby's 4 months old and not waking up at night, someone's davening for you in Shemayim up there. It's a bracha. You know, I never wake a sleeping baby, like never. Maybe if I'm leaving for the airport, but never than that, never wake a sleeping baby. Yeah. I mean, unless the baby's a newborn, induced, epidural, yellow, jaundice, then that's a whole different, but by 4 months, never. Okay, let's go. What's the next one?
Next comment was, remember fed is best.
Remember fed is best?
Not sure what that means.
Okay.
I think that was really small to the one before.
Okay, got it. Yes. But I wouldn't wake my baby in the middle of the night.
Right. Okay. I think that covers everything.
Okay, excellent. Thank you for joining us. Thank you. Go ahead. Thank you. Your next lecture, next
Yes. We're gonna have you. Don't worry. Where's the last thing right before. A very special thank you to our sponsors. Again, they chose to be anonymous, but Hashem should bench them with our Chayla Hayama. They should have children and they should have all the brachas, parnasa, shalom bayis, everything should be amazing for them.
Amen.
Thank you so much. And if anyone would like to sponsor our upcoming classes, you can always be in touch with me. Thank you.
Okay, great.
Okay, yay.
Okay.
Are you sure? You want to start?
Sure, of course. That's why I'll bring them. Okay, for sure. Okay, let's take your